March 2020, a time etched into our brains like a birth date or an anniversary. It was a time when the world stood still. Stores shuttered their doors, events were canceled, and the fear of the unknown ran rampant. Everyone was asked to stay home. Everyone, that is, except for first responders and healthcare workers. These were truly unprecedented times. Like many hospitals around the world, Hotel Dieu Grace Healthcare, a specialty hospital in Windsor's West End, was challenged in ways it had never experienced. Programs were paused, staff were redeployed to assist with tasks they had never done before, and patients and families had to be separated in order to ensure and protect their physical health. With limited exposure and increased precautions, the challenges still came. Our hospital units experienced outbreaks. Our staff and physicians experienced burnout. Our patients missed touches of home, and our community was struggling. This was one of the most difficult times in healthcare history. But for Hotel Dieu Grace Healthcare, the pandemic was more than just a challenge. It was a call to action. We were innovative in our efforts to combat the start and spread of infection within our hospital walls. We rallied behind our healthcare team, lifting them up when they felt as though they couldn't go on. We designed our designated care partner program from the ground up to give our patients, clients, and their families the chance to be together once again while improving the care they received. And we upheld our duty to our community by supporting them every step of the way. When we heard that the pandemic was causing a mental health crisis of its own, we launched the Mental Health and Addictions Urgent Care Center to provide a safe space to recenter. When our long-term care homes were drowning with infection, we took the helm, steering them back to stability. When local cases surged and our hospital partners became overrun, we took patients in and provided them with high-quality, person-centered care. And when the much-anticipated day came where a vaccine could be administered, Hotel Dieu Grace Healthcare stepped up to offer another vaccination location, broadening access for our community. But we didn't stop there. We also took care of each other, prioritizing care for our colleagues. Our spiritual care team and our peer support team allowed us to lean on one another and give us strength, while others assisted with initiatives to show appreciation and boost morale and motivation. Through our Grit and Grace campaign, we shared our fears, our hardships, and our courage and triumphs with the world, giving each other a deeper understanding of the trials we faced. And with the kindness and love shown from the community, our spirits were lifted, giving us renewed hope and energy to persevere. Alongside these significant undertakings that evolved as a result of the pandemic, Hotel Dieu Grace Healthcare maintained its daily hospital operations and then some. Our teams rose to the challenge by launching 5 new programs, implementing an improved healthcare information system, and finding alternative ways to host fundraising events through our foundation. These are just a few of our accomplishments in the midst of a difficult time. While we will be the first to admit that we didn't get every step right in the fight against COVID-19, we are proud of what we have achieved despite the challenges we faced. We are proud of our healthcare team. We are proud of our hospital. We are resilient. We are dedicated. We are strong and compassionate. Our hospital's triumphs are all of our triumphs. Today, we can look back on all that we have achieved by honoring our past and living our mission each and every day. Hotel Dieu Grace Healthcare will strengthen its legacy as we look to the future. I've been working in public service for 35 years. I've never gone through what we've all experienced the last 3 years. Transitioning away from what has been a global pandemic that's created challenges across all sectors, but in particular healthcare, it really provides us with an opportunity to look at the lessons that were learned. I've been part of Strat Plans as a partner. I've been part of Strat Plans as a lead person. This one in particular really felt good around the frontline engagement. And it was during those Did We Get It Right sessions that was validated for me as well.
Hotel Dieu has always been an organization that is focused on delivering patient-centered care through all of the various initiatives, whether it's staff development, patient transitions. Our focus will always be the patient and what they need to have a great experience here at Hotel Dieu.
The care is about our patients. Post-pandemic, it's about our people. And it could mean our community patients, our community workers, our frontline staff, our patients that are here. But again, it's the care that we give to each other as well as to our patients.
It's really important that our patients be able to transition through the healthcare system in a streamlined and coordinated way. Healthcare is a very complex and at times uncoordinated system. So we will be really looking at developing a transitions model where we can ensure that our patients have all the information that they need, know where to go to seek information, and that there's follow-up and support in every transition that they may be making from the time that they come to Hotel Dieu to even after they leave.
So our new strategic drivers are culture, care, and connections. We've taken that from people, patients, and identity. I think it's an evolution. It's going from being very us-centered to more looking out. It's more than just our staff. It's really about everyone in the HDGH community.
We certainly reflected on the values we had in our previous strategic plan, and some of them still really resonated closely with us. So teamwork is one that we've continued on with. Certainly with my team and with all the teams we work together with, it's very important that we're all moving in the same direction as a team for the same goals and objectives. Kindness is a new value that we brought into the group of our values, and that was based on the feedback that everybody gave us through all the sessions, that was something everybody really wanted to see.
We are not an acute care hospital, so when I explain that to the layperson, the best way to describe it is we don't have an ER, we don't have an OR, nor do we have an ICU. Instead, we're a specialty hospital, and specialty hospitals focus on very specific disciplines. We focus on children's mental health, adult mental health and addictions, and complex medical health along with rehabilitative care. Obviously, you need a certain expertise in those disciplines, and we thought that it was important to reflect that in the new strat plan, and clearly our staff and our partners agreed with that approach.
And the last one is social responsibility. Of course, making sure that everything we do has that equity, diversity, inclusiveness built and embedded into it. So it's really important that the work that we've started is continued, and we recognize as an organization that this is something we want to make sure we do in not only providing care, but in general how we work.
One of the most important aspects of a strategic plan might not be what folks would think would be the obvious answer. In my opinion, it's the voice of the people we engage that's the most critical part of it. So whether it be an external partner that already works with us in some sort of collaborative way, whether it be a government official, someone from the leadership group, and clearly the most important voice, in my opinion, is that of our frontline people.
Our frontline staff is our organization. If we don't have our frontline staff, then we really don't have a reason to exist. So it's extremely important that our frontline staff are engaged, that they are a part of this, that they believe in the work that they are doing, and that they have the skills and knowledge to do that. So just as important as the patients is just as important that the staff be involved and have their voice in all of this as well.
In speaking about the physicians' role through the strategic plan, they certainly have been involved. We have an excellent group of physicians here who I think are very compassionate and very kind, because sometimes physicians have that tendency to come in, do their work and leave, but we really want to embrace them in terms of bringing them as part of this plan.
People just want to work in a place where they feel respected, cared for, and safe. And I think what was exacerbated during the pandemic were some preconditions. I think we were in a precarious situation from a healthcare perspective. There were challenges, shutting down the campus, restricting people that could come here, even restricting employees at times. And the return back has been a bit of a challenge.
We're experiencing issues with our recruitment and our retention right now. I think the biggest piece of that is going to be getting feedback from staff through different focus groups and different working groups, and helping them tell us what they need. And then implementing a lot of the things for Health Human Resources is going to be a 5-year plan. We can't do everything in year 1, so we're going to take some key pieces away from those focus groups and say, what's sort of the low-hanging fruit that we can tackle now? And then looking at what's that 2, 3, 4, 5-year plan, and that might be some more in-depth kinds of staff development through conferences or learnings.
I think definitely having the staff involved from the very beginning and giving them that opportunity to let us know where they thought we were at, really help build a plan where they could see their voice in the plan and see how they could contribute on a go forward, so that it isn't just a plan of the executive team or the management team, it's a plan of everybody who works here.
We can't do this alone, so it's very important that we continue to develop and evolve our partnerships and our connections with our community so that we can make sure that our patients are getting the comprehensive and thorough care at all points in their journey.
We're looking at data to drive our decisions. If we're going to have a new plan, we need to have the data to support that it's the right thing to do, that it's what we need, it's what the community needs, it's what the patients need, and then evaluating those outcomes to make sure that we have a quality program. It's very important to have that lens to look at how we are seen both from inside and outside of our hospital, and we really do want to establish ourselves as that specialty hospital, and we need to make those connections with our partners very front and center of our work.
Living our mission and strengthening our legacy. It's not just a tagline, it's very real for us. And I take everybody back to over 135 years ago, when 5 nuns traveled to this community to establish a orphanage. And when they came down here, this community, the town of Windsor at the time, had no hospital, no healthcare support. And they saw a real need. And so a hospital was created in 1888. When you look at the premise of those principles, working with the disenfranchised, the marginalized, and the most at-risk people of our community, that really applies today. So it's really about our mission. In fact, I've often said that 10 years ago with the realignment of services and coming to this beautiful campus on Prince Road, it was a full circle decision. It was meant to be, because we're doing exactly what our founders launched 135 years ago.